chance of increased likelihood. That's a big number. So that's one reason that we do on the balance training. There's actually another research study that will show you that if you tape somebody's ankle before you do balance training, you can accelerate or actually decrease the amount of time it takes to retrain them by as much as 2 weeks. That's a big deal. It's a little bit counterintuitive because why would I brace something before I train it? Well, because again, we're fueling that proprioception from the skin, which helps give more information to the brain to figure out how things are supposed to work. So, beneficial, expensive, but a lot of times not for the reason that people think it is. So, what's next? We went over this, yes? Reconstructions, all right, so fracture dislocation. We get there too? Not quite.
That's us.
Yes.
Stop on the slide before.
Huh?
The slide before.
Diamonds where we stop?
Yeah. No, the
All right, so let's do Achilles. Achilles tendinopathy. You've got an area called the watershed. So about 2 to 5 inches above the calcaneus, you get really crappy blood flow. You've got a sheath that covers it, your synovial sheath that goes around the tendon itself. And so you've done something to irritate chronically your tendon. And the best way to kind of phrase this is that if it gets, you're getting all this wonderful inflammation in there, which is chemical mediators, which we've talked about a bit. So we've got this fluid and chemicals, and they're encouraging through chemotaxis other chemicals to come in. Those leukotrienes are dragging in other things, and the lipoxin is encouraging the monocytes, and blah, 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 blah. But there's stuff in the sheath that's not supposed to be there. And the presence of that stuff makes life really uncomfortable. And if you go onto any blog, even the most current edition of Runner's World actually has somebody whining about Achilles tendonitis in there and about how to deal with it. If you go on any runner's blog, you're going to get 50 different answers of how to manage Achilles tendonitis. If you go look into any kind of supply catalog, you're going to find 50 different products on how to manage Achilles tendonitis. Because it doesn't go away. It takes forever. It's a kiss of death for many, many middle-aged runners. I'm not that old yet. So, the presentation, soreness and pain in the morning. It's stiff. You get up in the morning, you step on it, and you're like, holy good God, that hurts. And then every step you take, it just makes it a little worse all the way through the day. And if you get to the point where that area, that watershed area is swollen, oh my gosh, if you touch it, it's just excruciating. So crepitus, anybody know what crepitus is? It's a crunchiness. So if you put your fingers on it gently, because otherwise they'll kick you with the good foot, and you have it just plantar and dorsiflex, just nice and easy, you feel this creaking crunchiness in that tendon. The best way to describe it is it feels like a squeaky door hinge sounds. And you're feeling that in your fingers. So how do you get rid of it? With almost any tendinopathy, eccentric exercise is phenomenal. If you can find a way to do eccentrics, well, let's see, let's take that back a little. We want to encourage healing. We want to encourage blood flow. The problem here is that even with walking, that's enough stress that it goes beyond that threshold of injury recovery. Your body mass, me at 170 pounds when I walk, and it's a single leg push-off, that propulsion is more than it wants to handle. And so that stimulates this pain cycle. So we need to increase blood flow while unloading it so it's not acting like it's injured anymore. So in most other places, I can do that fairly easily. Tendinopathy, biceps, tendinitis, whatever, you can find a way to reduce the load. Stop pitching the baseball. Start doing bicep curls. Start doing exercises that are lower threshold, higher repetition. That's your very typical approach to tendinopathies. Here, though, we've got to find a way to unload every step. So how do you think we should do that? How do I unload every step? Is it enough to focus on their practice, on their sport? We've got to find a way to unload them from the minute they get up in the morning. So that's the reason this thing drags. You'll find if you ever pull it up on even a Google search, it'll take 6 months to a year for some people to get over this, if they do. You can fix it in a week. Cool trick. There's a tape job called an Achilles tape. So, volunteer. Give me my runner. He seems motivated today. Ever have a problem with the Achilles? Yes. Still currently? Yes. Say it will fix it. You're going to love me forever. So, this tape is called elasticon. It's, as the name would imply, an elastic tape. Not crazy elastic, but enough. And it's strong. You'll notice that I'm grabbing scissors. I very rarely need to grab scissors. Slide back. I'm just going to bump you up. I'm sorry. It's a bad choice of place to sit today. And so we're going to be nice to Jared, and I'm going to give him some. Usually if I'm doing this for somebody, I end up shaving the leg because, well, leg hairs don't feel good to be ripped by lots of tape. So we'll cover there. And then I'm going to cover the top of the foot too and run out just in time. Amazing. All right. So not a very pretty job so far, but we'll get over it. So what I'm going to do is I'm trying to unload the Achilles. So the Achilles tendon tape job actually just pulls the foot down. So we're going to take an elastic tape, size it up to his foot. I'm going to cut a notch in the middle on each side. Keep it from sticking. Good. All right. Tear it. Anchor it. See that right there? That's a lot of leg hairs if that red tape wasn't there. I'm going to pull it taut. Do the same thing on the top of his foot. And now I can adjust the tension here. For the size of the person, I can adjust the tension by the tape. There's 3 inch, this is 2 inch. I can put multiple strips, which I'll do. So if he's in a relaxed position like this, now it's better than when he stands on this, then that tape will help pull his foot down. And it doesn't seem like it would pull much, but it's enough, that again goes into how much tension you put into the tape and how much tape you put on. It's enough to unload each step to where he won't have the pain when he walks around. So if he's unloaded throughout the day, then that problem is greatly resolved. Now, an issue with using pre-wrap or PowerFlex, Coflex, this is effectively vet tape, veterinary tape, to where it doesn't stick to hairs of the animals either. It's just a big puppy dog. Is that this stuff will slip. Pre-wrap more so than this. But, so if I can get it done to the skin, it's better. Stand on every step. Walk. How's it doing?
Really get my heel to even touch the ground.
That's cool.
So he's going to say that he can barely get his heel to touch the ground. Well, that means that probably got a little bit too tight, but you know, I'll get over it. That's right. So did it hurt today? I mean, does it hurt walking around?
It was a bit.
Can you feel it now? No. So just with a little bit of tape, we can unload it. Now, if we unload every single step throughout the day, then you've turned every step into something that created and caused pain, into something that's sub-threshold of that pain level, but you're still getting motion, which means now every step is a rehab step. Every step is now therapy. And so we went from continually increasing the pain to magically, within a week, it will resolve as long as he keeps doing this. And then we can back off the tension and progress him back into sport within 2 to 3. Which is pretty impressive. I think anyways. So, There are surgical interventions that exist. This is a tendinopathy. If it's left for long periods of time, you'll get fibrin, collagen fibrin depositions put in there, macrophages and everything else. I mean, there's more so that the fibrous depositions, which is going to thicken it, which becomes problematic. It can also rupture. This is a dog. Dogs are actually prone to tearing ACLs and rupturing Achilles tendons. So poor puppy. That's just green tape so you can see the ends of the Achilles. The Achilles tendon manages about 2,000 pounds per square inch. That's a lot of pressure. And so when it goes, it can sound like a gunshot. I've had it happen with one athlete on a field, and I was standing right next to him and didn't hear a thing. I can tell you that story sometime, but it takes a while. Most often in 30 to 40-year-old males, we don't really know why all of a sudden one day it decides to go. But usually frequently there's no tendinopathy beforehand. He just goes out and decides to play pickup basketball. He plans to go up and boom, it goes out. It's that sudden rain of weirdness.